Do artificial sweeteners cause diabetes?
Many people worry that artificial sweeteners might cause type 2 diabetes. This idea has sparked debate online and even among health professionals. Today, let's separate fact from fiction and look at what science really says about artificial sweeteners and their relationship with diabetes.
Where did the myth come from?
The concern comes from studies linking high consumption of sugary drinks with diabetes. When artificial sweeteners became popular as sugar substitutes, some assumed they might cause the same health problems. Early animal studies also raised questions, but their findings don't always apply to humans.
What does research show?
Large human studies haven't found proof that artificial sweeteners directly cause diabetes. Health organizations, like the American Diabetes Association, state that these sweeteners are safe when consumed within recommended limits. They can help reduce calorie and sugar intake, which is important for diabetes prevention.
Possible confusion and misinterpretations.
Some studies show that people who use artificial sweeteners may have a higher risk of diabetes. However, this could be because people at risk for diabetes are more likely to choose diet products, not because the sweeteners cause diabetes themselves. It's important to consider the whole picture.
Bottom line, artificial sweeteners and diabetes risk.
Current evidence does not support the claim that artificial sweeteners cause type 2 diabetes. Used in moderation, they are considered safe for most people and can even help those who are trying to manage their sugar intake. The best way to prevent diabetes remains a balanced diet and lifestyle.